This is Jenna Nikina on eyesurgeontalks, and in this video I wanted to discuss what happens before cataract surgery. So you've been scheduled for an eye operation, you're coming in to have your cataract done. What can you expect on the day? This may not be something you're very familiar with, you may not have had any surgery before, and so there's a lot of anxiety around this, which I wanted to help dissuade. So, first of all, most eye operations will be done under local anesthetic, which means that you will not be asleep for it. Your eye will be numb, so you're not feeling any pain, but you will be aware of everything that's happening. And this can be a big point of concern for patients. I do have a video also explaining the types of anesthetic that we use during cataract operations, if you are interested in that. But on the day of admission, you will typically come into the hospital and you will be put in the waiting room. And this will be a day waiting room, so most units will have sort of chairs for you to sit on to wait, rather than necessarily a hospital bed. Although in some places you may find that you do get a room and a bed to yourself. You will need to have some drops put into the eyes, similar to when you have in clinic. And the drops are there to dilate the pupil, to let us see your cataract so that we can take it out. So after you've had the drops done by some of the nursing staff, you'll find that your pupil gets dilated and your vision starts to get a bit blurry. Either the surgeon or one of the other theatre staff will see you before surgery, and they will usually mark the eye to make sure we know we're agreed on which side we're doing. And you will also have your consent form done or consent form confirmed if you have signed previously. So you would have had a discussion at some point about the risks of cataract surgery, just to be aware of any problems that might happen and to make sure that you're happy to proceed. After the paperwork is done, you should be ready to go through when the operating team are ready for you. For the surgery itself, we'll ask you to lie down on a special bed for us and get you comfortable. A lot of people worry about the fact that we say, look, you need to lie flat and still for the operation. The vast majority of people have no problem staying still enough. And it's not that you need to be completely dead still all the time. If you do need to adjust your position or move during surgery, this is possible, as long as you give us a little bit of warning about that and not move around suddenly. And the bed as well doesn't need to be completely flat. It moves in lots of different ways to get you comfortable. We've got special neck support we can offer to make sure that you are lying down in a way that means you are comfortable and can stay there for a little bit of time. And then we will tilt the bed if needed in order to have the right position for us to be able to get at the eye. When you're lying down on the bed, we'll put some anesthetic drops in the eye to numb them. And then you'll have a cover put over, which usually sticks to the operating side, and then it's like a towel that gets raised up off your nose and mouth so you can breathe easily underneath. It'll feel like you're in a little tent. And that's done just to keep the area around the operated eye clean, and also kind of separate the operating field from everything around it for sterility purposes. The operation itself usually takes about 10 to 20 minutes, occasionally a little bit longer if we need to do some extra steps. But if there's any problem, you can talk to the surgeon and the surgeon can talk to you because you will be awake. Just the important thing is if you do need to suddenly move or cough or have any other problem, just to give the surgeon a little warning that they can make sure everything is safe to allow you to do that. So hopefully this explains some of the things that happen on the day. Practices can vary between different hospitals and surgeons, but most of us will do mostly similar things.